This presentation summarizes the legislation and regulations in Alberta that are relevant to psychological health and safety in the workplace. They can be consulted and utilized by occupational therapists, whether they are employers or employees, to prevent, reduce, and address psychological health in their workplaces. According to a 2009 survey conducted by the Alberta Institute of Health Economics, 44% of females and 33% of males employed in Alberta experienced at least one psychological disorder over their lifespan. These findings underscore the importance of psychological health and safety in the workplace. The psychological hazards most frequently reported in the literature by occupational therapists include workload, work overload, which, in addition to being inherently stressful, can result in working at a superficial level due to lack of time. For example, an occupational therapist, while discharging a patient from acute care, may not have sufficient time to deal with their concerns and anxieties about going home, as she must concentrate on prescribing equipment for their safety. In the area of work content, this refers to work that is too challenging or not challenging enough. For example, an OT may feel she does not have adequate knowledge of a certain practice area, or conversely may feel frustrated that she is not practicing at her full scope due to ambient policies and procedures. Work process can refer to ambiguity of roles, to the lack of control over one's work, or to lack of participation in decisions made about one's work, particularly in times of change, as well as a lack of supervisory support and training. Lack of autonomy and respect. For example, many occupational therapists report needing to justify their services and/or explain why they are relevant. Psychological health is important to workers, to the employers, and to the patients and clients they serve, because it comprises our ability to think, feel, and behave in a manner that enables us to perform effectively in our work environments. Within the context of one's workplace, psychological safety becomes critical as it deals with the risk of injury to psychological well-being that an employee might experience, thus limiting their effectiveness at work. Improving the psychological safety of a work setting involves taking precautions to avert danger and injury to employee psychological health. Following are resources to guide both occupational therapy employers and employees in doing this. In Canada, administration of occupational health and safety is a provincial territorial prerogative, save for the public service and federally regulated agencies and workplaces. As such, this presentation will address Alberta legislation only. Provincial health and safety legislation, which has historically focused on physical health hazards, such as lifting and handling, infection control, and needle stick injuries, stipulates that employers have a legal obligation to maintain a healthy and safe work environment. However, recent legal decisions suggest that this obligation extends to the need to also maintain a psychologically healthy and safe workplace. Thus, workplace practices that create risk of psychological injury can lead to legal liability. This applies to situations where psychological workplace hazards result in persons both acquiring psychological ill health on the job and/or sustaining exacerbations to their existing mental illness. The former refers to situations in which healthy individuals become psychologically compromised due to chronically stressful and/or demanding workplace environments, while the latter refers to persons with an existing mental ill diagnosis that is negatively impacted by workplace conditions. It is also important to understand and to remember that legislation and well-documented workplace standards recognize that responsibility for workplace health and safety rests with both workers and employers. Occupational therapists, whether they are employees, such as hospital or community-based clinicians, or employers, such as owners or operators of private practice offices or clinics, must thus understand and carry out their occupational health and safety responsibilities as they relate to both physical and psychological domains. Legislation and other resources have been developed to guide both occupational therapy employees and employers in their efforts to do so. This requires that OTs be aware of their legislated responsibilities in order to collaborate with both employees and employers by, among other things, raising awareness of potential psychological hazards and assisting with their removal or mitigation. As employees, occupational therapists must also understand the avenues available to them for advocating in this regard. For example, occupational health and safety legislation, collective agreements, and/or contract stipulations that are applicable. Each of these 6 pieces of Alberta legislation contain information and stipulations that can assist OTs in addressing psychological hazards in the workplace. They will be briefly described individually. Beginning with the Occupational Health and Safety Act. This act defines an employer as a person who is self-employed in an occupation, employs one or more workers, is designated by an employer as the employer's representative, for example, functions as a manager or a supervisor, or is a director or officer of a corporation that oversees the occupational health and safety of workers employed by the corporation. For example, an occupational therapist who agrees to sit on councils or boards, such as ACOT or SAOT, or other nonprofit organizations, automatically assumes employer responsibilities. Employer responsibilities are clearly laid out in this act as follows. Employers must identify hazards, conduct written hazard assessments, and implement controls. In the context of occupational therapy, an example of a hazard might be a workload that requires excessive overtime. For example, a hand clinic that routinely and chronically extends hours past its scheduled closure. Employers must report and investigate psychological hazards and risks. They must inform workers of any hazards on the job site, for example, working with highly traumatized clients on an ongoing basis. Employers also have a specific responsibility to ensure that workers are aware of their responsibilities and duties under the OHS Act. And finally, they must ensure that workers completing work are either competent to do so or are under the direct supervision of a worker who is competent. This brings in the issues of professional development for employees, as well as adequate and effective professional supervision and performance feedback. For workers, the occupational health and safety legislation extends beyond individually focused strategies in dealing with psychological hazard, such as improving one's time management or learning mindfulness practices. The legislation stipulates that employees must also take responsible care to protect the health and safety of themselves and of other workers. This implies the reporting of psychological hazards to appropriate parties, just as you would a physical hazard. Employees must also cooperate with their employer to protect the health and safety of themselves and other workers. It is important to note here that legislated responsibilities extend beyond oneself to one's colleagues. The Alberta Human Rights Act prohibits discrimination based on mental disability, which is defined as any mental disorder or learning disorder regardless of its cause or duration. The Act requires that employers and service providers make reasonable efforts to accommodate individuals with disabilities to the extent that undue hardship is not caused to the workplace. Specifically, Section 7 stipulates that no employer shall refuse to employ or refuse to continue to employ any person or discriminate against any person with regard to employment or any term of condition of employment based on physical or mental disability. This seemingly could apply to both existing medical conditions and/or those resulting from psychological workplace hazards. Though the Workmen's Compensation Act provides for compensation for a person who is incapable of becoming gainfully employed due to physical or mental capacity, on its face, unlike legislation in other provinces, this does not appear to apply to illness or disability that directly results from psychological hazards in the workplace, but rather to a physical trauma such as a head injury. Clearly, advocacy is indicated and/or the legislation needs to be tested through the justice system in Alberta. The Alberta Health Professions Act. Whether they are employees or employers, OTs are regulated health professionals, and as such are bound by the ACOT standards of practice, which list and define regulatory requirements for minimal practice standards, as well as the college's code of ethics, which lists the values and principles that guide occupational therapy conduct. As relates directly to occupational health and safety, Standard 9 of the college's standards of practice stipulates that the OT shall maintain appropriate management structures and organizational structures and processes for his or her practice. Appropriate includes working conditions that do not place self and others at risk of psychological injury. And secondly, that OTs must demonstrate safe work practices by identifying potential risks and minimizing those risks in the practice setting. Again, this applies to psychological risks and hazards. By virtue of holding a license to practice, OTs are legally bound by the ACOT Code of Ethics as well. The competence section of the Code of Ethics relates directly to OH&S in the workplace. It specifies that OTs shall strive to achieve high standards of competence. This commitment to competence is indicated by 3.1, reviewing practice and engaging in professional practice. 3.2, providing services only in areas of competence. Each of these stipulations might assist in addressing stress relating to feelings of incompetence in one's workplace. OTs must also refrain from providing services when impaired by substances and illness. Health Science Association Collective Agreement. Though this is not legislation per se, it is a legally binding document. Section 42 includes the following stipulations with regard to OH&S considerations. The parties to the collective agreement will cooperate to the fullest extent in the matter of OH&S accident prevention. The employer and employees will take reasonable steps to eliminate, reduce, or minimize all workplace safety standards. As discussed in the background paper for this project, recent legal decisions suggest that this obligation extends to the need to maintain a psychologically healthy and safe workplace. And lastly, if an issue arises regarding OH&S, the employee or union shall first seek to resolve the issue through discussion with the applicable immediate supervisor in an excluded management position. If the issue is not resolved satisfactorily, it may then be forwarded in writing to the committee. In addition, Letter of Understanding number 12, which is attached to this collective agreement, states that whereas the parties agree that for employees in some disciplines, day-to-day flexibility around their start and end time provides the employee with more control of the way their work is done, and also increases their ability to provide responsive services to clients. This is not an exhaustive representation of the provisions of the HSSA agreement. Rather, the latter are examples of potential avenues of advocacy for OTs who may wish more autonomy in their work. This agreement provides a process for seeking this out with one's employer. Hopefully, this brief review of legislation addressing psychological health and safety in the workplace will provide useful and effective resources for collaboration with both employees and employers in your workplace.